Time for another Hospital Foundation chat. Once again, Cassandra James in studio, the Blanche River Health Foundation Executive Director, and she's brought George VanSlyke, the Blanche River Health CEO and Prez, today. Good morning, ladies. How are you?
Good morning.
Okay, happy to be here on this cloudy day.
I was kind of apprehensive that you would have brought snow with you today, but
I had fears.
I'm thankful you haven't.
It took me 10 minutes to get up this morning, Fergie, so we're okay.
So since we last chatted last month, what's new? What's going on, Cassie?
Well, first of all, I think it's very kind that you guys have employed Jimmy Kimmel as the choir leader.
Well, we got to give Jimmy something to do.
I just have to say, I think that's very kind of you.
We get free speech in Canada. He's more than welcome.
Yes, exactly. Exactly.
You should be my spokesperson.
Yes, yeah. Oh, man. Well, it has been a busy summer. We've had the pleasure of supporting the monthly staff barbecues to celebrate the hospital team members, which was really nice to be a part of and meet more people at the hospital. Special shout out to the Prono store who donated cookies for every staff member for all 4 months at both sites. That was really nice. Sweet. Yeah. Cool. And speaking of the Prono store, we did celebrate them this summer. They raised over $52,000 with their Nevada break apart tickets and sales in 2024. So we were very excited about that. And a personal moment for myself. My mom is the baker at the Prono store, so it was nice to work with her baking up all those cookies together.
That's why it's so good.
It is.
So that's how the cookie thing
That's right.
came together.
That's how these things work here.
A little extra love in those cookies. Yeah. The community really has stepped up, though. As we shared last month, Alamos Gold Young Davidson donated over $43,000 to launch those ER wait time clocks. Mm-hmm. And thanks to Basting for Kids, both sites now have a mobile gaming station with a flat screen TVs and Nintendo Switches. That's one has been a big hit. It really makes visits a little less stressful for kids and families, which is exactly what the organization was hoping for when they made the donation.
Nice.
There's been so many other things, but I don't want to keep you here all morning.
All right, George, on the hospital side of things, what's going on? Anything new?
Yeah. Oh, Cassie mentioned most of it already. No, just kidding.
Stealing your thunder.
From a staff wellness initiative, we're actually quite happy. We've just concluded our barbecue this September. So from June to September, once a month, we offer free barbecue meals for all of our team members. Okay. We also have a family fun day coming up for 80 Creek. And I just want to give a shout out to our environmental services staff, laundry and housekeeping. They're celebrating their week last week, and we are so thankful for each and every one of them. Also, just to mention, the foundations supported giving stethoscope to our NOSM students, and we welcome them again, and we're really trying to nurture this relationship at this stage of the game. So we're very proud and pleased.
Mm-hmm. That was fun.
Lots of... You turn on any news program, and when they start talking about hospitals, the first thing they start talking about is deficits and staffing and whatnot. You guys have strategies to deal with all this?
You just wanted to ask the nice question first, and then this one.
It was the third question. I was going to start with that one. What was the third one?
No, seriously speaking, though, it's been very challenging times for actually over 90% of the hospitals in Ontario are facing deficit situations, and we're certainly not immune to that. So we've been working with the ministry to resolve the issue, but in the meantime, Blanche River Health has been doing its due diligence by reviewing our staffing model and all aspects of our operation. And this review actually resulted in adding staff in areas with increasing pressures, but it also means reducing staff in other areas. The one commitment that we have made to all of our team is that there will be no layoffs and no job loss because of these changes. And I'm very pleased to share that we're almost at the end of that implementation, and we have kept that commitment to date.
That's good news.
It is. And, you ask about recruitment retention as well. As we do this due diligence portion, we also continue to offer incentives, including bonuses and housing to recruit people. Okay. We have the community referral that's still in effect. So if you successfully refer a staff member to the hospital, then you can get up to $2,000. And for wellness, we have added investment for education and also for wellness support. And really right now, we want to focus on building that culture where people would want to stay. Yeah. And people would feel pride that they belong to Blanche River Health.
Yeah, exactly. On the foundation side, Cassie, how you guys help out with recruitment and whatnot?
Well, from our perspective, obviously community donations really help with funding the recruitment efforts. So that's a big way to bring in healthcare professionals. And I would have to just say that the hospital's HR team is really doing an amazing job showing staff and candidates that it's really a great place to build a career, like George just mentioned. It's not just a job. So obviously, I would say as long as people can keep up with the donations and we can secure more funding from other municipalities and businesses that support our recruitment efforts, we're doing our best to support all of that.
So, George, Cassie's talking about companies, community members making donations and whatnot. Can you share some examples?
Oh, yeah, for sure. Actually, we're not just talking about cash donation here. We've welcomed a new physician this year, and the community had stepped up. For example, the Fed downtown in Kirkland Lake and Muddy Moose, they donated vouchers, meal vouchers to welcome, those that we are looking at recruiting. The dance studio, the Rhythm and Motion Academy, offered discounted class fees for the physician's children, for example.
Nice.
The town of Kirkland Lake has offered pool access to the complex, and even my gym in Kirkland Lake has also offered access to use their facility. So there's so many ways that our community can support welcoming new people and new staff in our communities.
Last time we talked, we spent a lot of time talking about the ER weight clocks. I understand those are up and running.
Sure.
I listen to my wife at home sometimes as she's talking to some of her colleagues, and I know there's some new equipment that has snuck in the building in the last little bit as well. Can we talk about that?
Yeah, for sure. I love talking about the new equipment. So yes, the ER clocks are now live at both sites, and soon everybody will be able to access them online as well, so that'll be nice.
Okay.
The other big news has been new cataract equipment that we funded. It was a $50,000 investment.
Wow.
So just a couple pennies. Cataract surgeries are one of the most common day surgeries at Blanche River Health, and with the upgrade, our visiting specialist, Dr. VJ, can basically double the number of procedures that he does. So that just means more people getting their sight back faster and sooner and without travel.
That's the big thing. You get it done right here.
Right here.
Don't forget that the foundation is also supporting the not so glamorous equipment, like, behind the scenes. For example, they donated to the hospital $50,000 to clean scopes, and also like $2,000 to
clean scopes.
Clean scopes that enter our bodies.
I don't want to know. I don't want to know.
But you want to know they're clean.
I want to know they're clean.
So those kinds of support is amazing, because it's not just the things that people can relate to, but behind the scenes that make everything, infection free and go as smoothly as possible. So we're very thankful.
So, with all this stuff going on, $50,000 for the scope cleaning machines, the cataract machine, the ER weight clocks. Where's this money coming from?
From you.
From all the amazing
Does my
people.
bank know?
Yeah, we haven't advised your bank yet. Oh, man. But no, really, it's donations. It really is. Obviously, there is some ministry funding, but it's very limited when it comes to equipment. So when we say every dollar matters, we really mean it. So, and when local businesses step up, like the Kirkland Lake Dental Office, who made a generous donation to the OR this year,
nice.
It really does help. But our basic annual equipment needs is about $500,000, $500,000 a year.
Wow.
So the need is constant. That's why we're here constantly asking. As George says, we are professional beggars now.
PBs.
You can donate anytime at brhfoundation.ca.
So who knew your budget and my budget were the same?
I also want to add to what Cass is saying. It's fascinating to me that one of the programs that took off was the Thankful Thursday at Blanche River Health. So if you're thankful for, what somebody did, we post on social media, and the appreciation that people felt was great. But also, if you want to take it a step further, if you want to donate through our Grateful Hearts program, because you've had a great experience with a physician or a staff member, you can make a donation in their name, and, it's double win, and we're really, really excited about that. All you have to do is you can learn more or donate through the grateful.brhfoundation.ca.
Imagine if everybody donated $5 and a thank you. Imagine the morale boost that would travel through the hospital and the money that we'd raise for equipment.
True enough.
Yeah.
True enough. 7:49. We got about a minute left. Anything we've overlooked this morning, Cassie?
No, I don't think so. I think we've celebrated lots over the summer. Obviously, a big thank you to our communities, whether making donations and celebrating the staff through the Grateful Hearts program or buying those Split the Pot tickets. We're really grateful for the support.
George is the big cheese. You get the last word this morning.
No, I just really want to thank all of you for your support from the bottom of my heart. Healthcare services are not 10, 20-year programs. It's a lifetime service, and your investment today will be benefiting generations to come. So thank you so much.
Well said. Thank you, ladies, for coming in.
Thank you so much.
See you guys
Thanks.
again in another month or so.
I'll bring the snow.
No. No, I'd like to wear shorts.
I'll see you at 10 o'clock next time, Fergie.
You guys have a great day.
Okay, thanks.